Welcome to another episode of the Med Madness podcast, where we dive into the essential medical topics you need to know. Today we're focusing on epithelial ovarian carcinoma, a serious and often silent condition that primarily affects postmenopausal women. This episode will cover the clinical presentation, risk factors, diagnostic findings, and management strategies. By the end, you'll have a clear understanding of how this disease presents and progresses, as well as the best approaches for diagnosis and treatment. Epithelial ovarian carcinoma, or EOC, is the most common type of ovarian cancer, and unfortunately, it often presents at an advanced stage due to its subtle and non-specific symptoms. Let's explore this topic in detail. EOC can be particularly challenging to diagnose early because its symptoms are often vague and can be mistaken for less serious conditions. Patients may present with a variety of symptoms, ranging from being entirely asymptomatic to experiencing subacute or acute symptoms. Next, let's discuss the different ways EOC may present. Asymptomatic cases are usually discovered incidentally during a routine pelvic examination or imaging for another condition. On the other hand, subacute symptoms often include pelvic or abdominal pain, bloating, and early satiety. These symptoms can be easily overlooked, leading to delays in diagnosis. When the disease is more advanced, it can present acutely with significant abdominal distension, obstipation or constipation, and even respiratory difficulties due to the pressure exerted by the growing tumour. Now let's look at the risk factors associated with EOC, which are crucial for early detection and prevention. Key risk factors include a family history of ovarian or breast cancer, genetic mutations, specifically BRCA1 and BRCA2, and age, with the majority of cases occurring in women aged 50 and above. Other contributing factors include endometriosis, infertility, and early menarche or late menopause. On the other hand, some protective factors can reduce the risk, such as oral contraceptive pill use, having multiple children, and breastfeeding. These factors are believed to lower the lifetime number of ovulations, thereby decreasing the risk of developing EOC. When EOC is suspected, the diagnostic process involves several key steps. First, laboratory tests often reveal an elevated CA-125 level. CA-125 is a protein that is often elevated in the blood of women with ovarian cancer. It's particularly useful in postmenopausal women to help stratify the risk when a pelvic mass is identified. Imaging studies, such as pelvic ultrasound, are crucial for characterizing the adnexal mass. Findings that are concerning for malignancy include a solid, complex mass with thick septations and the presence of ascites. CT scanning is typically performed if the ultrasound findings are suspicious, to assess for distant metastases and aid in surgical planning. Now, let's discuss how EOC is managed. The cornerstone of EOC management is surgical exploration, particularly in cases where the disease is confined to the pelvis without distant metastases. During surgery, staging is performed, and as much of the tumour as possible is removed. This is known as debulking. In many cases, surgery is followed by chemotherapy to target any remaining cancer cells. To illustrate this, let's consider a brief, real-life scenario. A 65-year-old postmenopausal woman visits her physician with complaints of persistent bloating and early satiety that she has noticed over the past few months. On physical examination, a firm, non-mobile pelvic mass is palpated. Given her age and the concerning nature of the mass, an ultrasound is performed, revealing a complex ovarian mass with thick septations and some free fluid in the abdomen. Her CA-125 level is elevated. The imaging and laboratory findings raise suspicion for epithelial ovarian carcinoma. She is referred to a gynecologic oncologist, and after further evaluation, she undergoes exploratory laparotomy, where the diagnosis is confirmed and the tumour is surgically debulked. In summary, epithelial ovarian carcinoma is a challenging disease that often presents at an advanced stage due to its vague symptoms. Early recognition of risk factors, careful evaluation with imaging and CA-125, and prompt surgical intervention are critical for improving outcomes. To deepen your understanding, don't forget to check out our pre- and post-podcast quizzes and use our Anki flashcards to reinforce your learning. Stay tuned for more episodes and keep mastering medicine with Med Madness.